The self-auditing mode of the community services sector. The community services sector receives government monies based on applying for grants or to provision a service for the community. This includes homelessness services, domestic violence shelters and counseling, social housing and educational programs. Funding is provisioned on a formula and knowing where and whom to speak to within government. Grants and/or service provision is of course seen to be independently vetted with those best able to provide services gaining access to those funding dollars. However, that is rarely the case, with most agencies being forewarned of the results months, perhaps even years before funding is released. Noting this is not the point of this video. The point is about self-auditing of services. That is when auditors are chosen by agencies to review expenditures. Targets and KPIs are not measured by government unless the project is driven by the need to deliver services to an expected number within an expected time. This leads to government being unable to audit the functional success or failure. For example, if funds are allocated to reduce illegal drug use within a certain demographic or location, the agencies rebadge their service delivery to best practice, which is no longer about reducing illegal drug use, but about harm minimization. Agencies are granted dollars according to need. As such, the need is never reduced and is an ever-growing elephant. By this method, ideological, untested programs could be introduced. For example, transsexuality is transformed into gender identity, and the reasons why someone wishes to be the other gender is because of their free choice. Whether or not that free choice is sound is not addressed. Simply the fact they believe it. In a number of cases of sexual abuse as children when young adolescents are taken into care, and trans identity theory is used to prove those abused teens have always felt the need to transition. For young girls this means being allowed to have fake penises and adopting male names. In one case I know of a girl who wished to be a boy, had sex with a boy who was confused and asked his support worker was he homosexual because he had sex with another boy. Notably, psychological interventions in such cases are based in and of the premise, gender identity is both innate and fluid. The counselors and social workers will ignore the abuse suffered as a reason why someone may wish to change gender, nor is the gender fluidity addressed as an outward symptom of being abused. All evidence points directly to, in such cases, gender identity disorders are based in of and due directly to being abused as a child. But back to the focus point. Government cannot audit such views, nor can government object to such practices. The advisements for such practices existing come from the very organizations gaining funding from government, and those organizations measure their success or failure, then report that to government, who dutifully refund service provision. Whenever government hear the words evidence-based, they should automatically know they're being duped. Because the evidence is not based in rigor. It is based in most cases on the mere fact the program exists, or an unsound research paper written by an ideologically driven university employee, or indeed in many cases a student's thesis.